we saw, for instance, in our mold studies, the peak frequency, of these different waveforms in the front of the brain, whereas electroactivity was slowed and even collapsed, meaning it seemed it wasn't flexible. It was, you might say, sampling at a slower rate. Your brain's not quite as sharp, and we believe that's because it's not getting enough juice from the brainstem to keep it aroused. A little bit like an attention deficit child. They don't get enough, much cortical arousal as they need. That's why they give them stimulants. Well, some of the mold patients or pesticide patients, they all look like the same way, like they're not getting enough arousal, especially in the frontal areas. On the other hand, sometimes we saw in more central areas that map out how you feel and what motor and sensory, sometimes we saw the opposite, hyperarousal. We call it cortical irritability, hypersensitivity to sounds and chemicals, pains. A lot of people would believe that's compensatory. In other words, when you see a lot of flurry of activity, it usually means something underneath that's not working. It's trying to compensate. And there is something called a default mode network in the brain, which is more these medial areas that sort of maintains homeostasis in the body. It's always on. Okay? It never rests when you sleep, when you're awake. And it's using most of the energy, probably 80% of your brain energy, to keep that going. And my theory is, in a lot of injuries, whether it's concussions or toxic injuries, that network of your default mode, which maintains, is disrupted. So people are working overtime, so they get tired easily. They don't have stamina, and of course, you're not ready to respond. It's sort of like having a computer that's always ready. Your brain maintains a state where you can move that arm when you need to, or you can quickly think, you're in a ready state. But that's exactly, even when you're asleep, it's maintaining that. And when that's not operating, then you aren't usually feeling very balanced. And if you look at what happens in mold patients or other toxins, it isn't just their ability to stay focused or remember something. They're usually having physiological problems of homeostasis. They can't regulate temperature. They have hormonal issues. They can't regulate weight, blood pressure problems. Almost any system can be impacted. Well, those are deeper brain areas, but they integrate into our conscious areas. The studies that have been done on other types of toxins usually show 60% of the time is frontal, 60% of the time is temporal, and then the brainstem may be 40, 50%, parietals 15%, but I mean almost any area can be affected. We see in the mold a lot of visual problems. Some of that seems related more like the optic nerve, but definitely these executive areas are affected, and maybe they're more affected because they are so involved in the emotional and physical regulation as well, and we know that that is getting disrupted by the biotoxins.